I'd like to welcome all of you and our distinguished guests, Principal, Dean, and CMS, Professor Mohammad Habib Reza sir, the Medical Superintendent, Professor Syed Amjad Ali Rizvi, Dr. Salman Shah from the Department of Community Medicine, and our Chairman of Medicine, Dr. Mohammad Aslam, and all the residents, nurses, and the patient attendants to this program. Like every program of Aligarh Muslim University, we will begin it with the recitation of the Holy Quran. So I request Dr. Mohammad Hatif to please come forward and do the recitation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والضحى والليل إذا سجى ما ودعك ربك وما قلى وللآخرة خير لك من الأولى ولسوف يعطيك ربك فترضى ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى فأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث صدق الله العظيم. Translation. By the morning light and by the night when it is still, your Lord has not forsaken you, nor does He hate you. Indeed, the hereafter will be better for you than this present life, and your Lord will surely get pleased. Did He not find you an orphan and take care of you? Did He not find you unaware of the path of truth and guide you? Did He not find you in need and make you independent? So, as for the orphan, do not mistreat him, and as for the beggar, do not speak harshly to him. And for the blessings of your Lord, proclaim it.
Thank you, Dr. Hatif, for that nice recitation and translation. I'd now like to request Dr. Kainat Khan to please come forward and felicitate our CMS. Dr. Alina Shujat, please come forward. For those who don't know, earlier this space was with the paramedical college, and by the help and support of the hospital administration, the medical superintendent, the chief medical superintendent, it has been possible that we have made this heat stroke ward. The Government of India guidelines are that we must have 10 beds with at least one fan between two beds and two coolers. Apart from that, we should have a fridge which should contain IV drugs, ice packs. So by the help of the hospital administration, we have all of that. So we have even placed posters which increase the awareness, and management posters also, so that our residents, Dr. Alisa, CMS and Principal. I'd now like to request Dr. Arham Khan to please come forward and present a bouquet to our medical superintendent, Professor Syed Amjad Ali Rizvi. I'd like to request Dr. Bushra Wasim to come forward and give a bouquet to Dr. Salman Shah, Deputy Medical Superintendent. Now, ladies and gentlemen, as you all know, climate change is a reality. या अगर हिंदी में कहें तो I'd like to welcome Professor Sadia ma'am. Please honoring us with her presence in this program on such a short notice. So I was just saying that climate change is a reality, and because of that, the number of heat waves in the country are increasing. in India, the periods between March and July are the peak periods, and Uttar Pradesh is among the 17 states of India where heat waves are very common and heat-related deaths are also very common. Between the period of 2015 to 2019, 4,775 deaths have occurred, and that is because of many reasons. One of the reasons is that the age group and the type of patients that are susceptible to heat waves and heat strokes are old age patients, laborers working in the fields, minors, and extremes of age, pediatric age group patients are also very susceptible to heat stroke. So it becomes very important to be able to know how to prevent heat stroke from happening, to diagnose it, and to treat it. So I'd now like to ask the Principal and CMS and Dean, Professor Mohammad Habibulla sir, to please say a few words on top.
Bismillahirrahmanirrahim. Good afternoon. Assalamu alaikum. Medical Superintendent Professor Amjad Ali Rizvi, Chairperson, Department of Medicine, Additional Medical Superintendents, members of the faculty, resident doctors, patients, attendants, and ladies and gentlemen. I will speak in Hindi because ये मैसेज सही जाना चाहिए कि हम किस लिए यहाँ जमा हुए हैं। हमारा मकसद ये है कि अभी गर्मी का मौसम शुरू होने वाला है, बल्कि कहीं कहीं शुरू भी हो गया है, और इस गर्मी के मौसम में हमेशा ऐसा होता है कि बहुत से लोग इससे बहुत सारी बीमारियां और लू की वजह से कभी कभी जान भी चली जाती है। तो अभी मेडिसिन डिपार्टमेंट एक बहुत अच्छा काम कर रहा है कि लोगों को जागरूक कर रहा है कि किस तरह से हमें इस गर्मी के मौसम में अपने को बचाना है, अपने बच्चों को बचाना है, अपने बूढ़े लोगों को बचाना है, और जो लेबरर्स जो मैदानों में काम कर रहे हैं उन्हें बचाना है। तो उसके लिए ये सैनिटाइजेशन प्रोग्राम रखा गया है, जिसमें पूरे मेडिसिन डिपार्टमेंट के फैकल्टी मेंबर्स और उनके रेसिडेंट डॉक्टर्स ये सब इन्वॉल्व हो रहे हैं। और इसमें जो है इनकी तरफ से जो मेन मैसेज है कि हमें अपने को बचाना है और अपने घर वालों को बचाना है और अपने पड़ोसियों को बचाना है। तो उसके बारे में डिटेल बात तो हमारे दूसरे जो प्रेजेंटर है वो बताएंगे। छोटी मोटी बातें मैं भी ऐड कर सकता हूँ। एक तो आजकल रोज आप लोग अखबार पढ़ते होंगे, तो उसमें आपको पता चलता होगा कि देयर इज अ वर्ड व्हिच इज नोन एज ग्लोबल वार्मिंग, यानी कि दुनिया गर्म हो रही है और समुद्र का पानी गर्म हो रहा है और 2 डिग्री से ज्यादा गर्मी पैदा हो गई है। जो आज से 10 साल पहले जितनी गर्मी थी उससे 2 या 3 डिग्री सेंटीग्रेड गर्मी बढ़ गई है, जिसकी वजह से लू का चलना और गर्मी का वक्त बढ़ते जाना, और इससे जो है जितने भी लोग काम करते हैं धूप के अंदर, जितने लोग लेबरर्स हैं और छोटे बच्चे जो खेलने के लिए मैदानों में चले जाते हैं और उनके पास पानी वगैरह की फैसिलिटी नहीं होती, तो वो गर्मी की वजह से और सफर करते हैं तो वो डिहाइड्रेट हो जाते हैं, उनके बदन में पानी की कमी हो जाती है, जिसकी वजह से उनके जिस्म पे बहुत बुरा असर पड़ता है और बहुत से बेहोश भी हो जाते हैं और कुछ की जान भी चली जाती है। तो ये गवर्नमेंट ऑफ इंडिया इनिशिएटिव है जिसकी वजह से हम लोग सब यहाँ जमा हुए हैं, जिसको मेडिसिन डिपार्टमेंट के डॉक्टर्स की जिम्मेदारी दी गई है कि वो एक 10 बेडेड स्पेशल वार्ड क्रिएट करें, जिसमें इस तरह के मरीजों को जिनको इमीडिएट मैनेजमेंट की जरूरत है वो वहाँ यहाँ पे सारे उपचार की सारी चीजें यहाँ मौजूद हैं। जैसा कि अभी डॉक्टर साहब ने बताया कि यहाँ पे एक फ्रिज है, यहाँ पे कूलिंग सिस्टम है, यहाँ पे कूलर्स है, तो कभी भी पहले तो यहाँ तक आने की नौबत ही नहीं आनी चाहिए। इसको हमें अपने ऑन रोड साइड या अपने नेबरहुड या अपने घर पे प्रोटेक्ट करना है। अपने बच्चों को पहले से बताना है कि गर्मी के मौसम में पानी खूब पीना है, और उनके लिए स्पेशल बॉटल्स रखनी होती है जो उनको दे दें कि बेटा अगर तुम बाहर जा रहे हो आधे घंटे के लिए भी तो इसको पानी पीते रहना। दूसरी चीज जो अपने बच्चों को, अपने घर वालों को, अपने बुजुर्गों को बतानी है कि धूप से अलग रहे। खासकर 10 बजे से लेके 4 बजे का समय ये बहुत ही खतरनाक है, इसमें लू चलने वाली है और जिसकी वजह से थोड़े आधे घंटे की भी धूप लगेगी और लू लगेगी तो उससे जान का खतरा पैदा हो सकता है। तो अपने घर वालों को बचाएं इस पीरियड में जिसमें पीक हीट होती है। उसके अलावा ठंडी जगहों का इस्तेमाल करें, छांव छतरी का भी इस्तेमाल कर सकते हैं। जिनको मजबूरी है कि धूप में जाना है तो छतरी का इस्तेमाल कर सकते हैं और अपने साथ पानी की बोतल जेब में रख लें और उसको साथ लेके चलें। तो अब इसमें ज्यादा डिटेल बताने की जरूरत नहीं है, इसलिए कि इसके लिए एक्सपर्ट मौजूद हैं जो आपको बताएंगे। लेकिन ये मोटी मोटी बातें हैं। एक तो पानी का इस्तेमाल ज्यादा से ज्यादा करना है, धूप के टाइम में बाहर नहीं निकलना है और छतरी का इस्तेमाल करना है। और अगर कोई आपको रास्ते में कोई ऐसा आदमी मिले और सबील का कायम करना है। सबील का कायम करना क्या है? ये तो रिलीजियस भी है और सोशल वर्क भी है। अपने घरों के सामने घड़े का इस्तेमाल, बाहर एक घड़ा लगा दीजिए, एक ग्लास रख दीजिए और उसके अंदर सुबह में पानी डाल दीजिए और उसके अंदर टैप होगा तो जो भी उधर से गुजरेगा उसको प्यास लगी तो आपने पानी पिला दिया। तो अगर हर 100 घर के बीच में एक सबील कायम हो जाएगी तो काफी हद तक इससे रिलीफ मिल सकती है। तो ये सब सोशल वर्क के काम है और हम लोग एज ए डॉक्टर्स इसको हम लोग फैसिलिटेट कर सकते हैं। यू हैव टू स्टार्ट एट योर ओन प्लेस, है ना। अपने घर से हम शुरू करेंगे तब जाके दूसरों तक पहुंचाएंगे। तो मैं इसको ज्यादा आगे नहीं बढ़ाना चाहता। थैंक यू वेरी मच फॉर इनवाइटिंग मी एंड आई थिंक दिस विल बी प्रोग्राम विल बी अ सक्सेस एंड आई हैव गुड विशेस फॉर यू एंड यू आल्सो स्टार्ट having these pamphlets and the outboards etc. displayed at various sites so that people will see it and you can have जैसे आपका अर्बन सेंटर है कम्युनिटी मेडिसिन का और रूरल सेंटर है कम्युनिटी मेडिसिन का, वहाँ भी आप इस तरह के प्रोग्राम करके वहाँ के गांव वालों को जमा करके तो इससे आप काफ़ी हद तक लोगों को रीच कर पाएंगे। और अब हम जैसा आपने बताया कि अपना मेडिकल कॉलेज की वेबसाइट है, प्रिंसिपल की वेबसाइट है, डीन की वेबसाइट है और मेडिकल स्टूडेंट की वेबसाइट है, उस पर भी हम लोग डाल देंगे। आप व्हाट्सएप ग्रुप में भी डाल सकते हैं। तो देयर आर वेरियस वेज टू कम्युनिकेट। तो दिस इज द बेस्ट बिगिनिंग and I hope that it will be a success. Thank you very much.
Government of India has made a national action plan on heat-related illness. It was published in July 2021, and the good part of that is that a major contributor, who is an executive member of the committee, comes from our medical college, from the Department of Community Medicine, Dr. Gulrez Azhar, who was my senior when I was doing my MBBS. So he is one of the members of this committee, and this protocol has been made by this association. Now I'd like to request Dr. Amjad Rizvi sir, please say a few words.
Good afternoon. मेडिसिन डिपार्टमेंट चेयरमैन और तमाम दूसरे कंसल्टेंट और रेजिडेंट को मैं मुबारकबाद देना चाहता हूँ कि उन्होंने बहुत अच्छा इनिशिएटिव लिया है। गवर्नमेंट ऑफ इंडिया की तरफ से गाइडलाइंस भी थी, लेकिन ये इनिशिएटिव लेने के लिए जो रिक्वायरमेंट थी उसको उन्होंने पूरा करा। एक वार्ड जैसा कि गाइडलाइंस में दिया गया उसके हिसाब से तैयार है किडनी स्ट्रोक के पेशेंट के लिए। और बाकी डिटेल्स कैसे मैनेज करना है उसके बारे में डॉक्टर हाबिब रजा और डॉक्टर दूसरे के लोगों ने बताया है और आगे भी बताएंगे। मैं ये कहना चाहता हूँ कि हम लोगों को जो भी पेशेंट ऐसे आए उसकी इंफॉर्मेशन और डेटा जो है अपने पास रखना है, ये बहुत ज़रूरी है। कुछ पेशेंट आते हैं हीट स्ट्रोक के, हम ट्रॉमा में देख के उसको एक ट्रिप चलाई वो ठीक हो गया तो भेज देते हैं, लेकिन हमारे पास रिकॉर्ड होना चाहिए। जो भी रेजिडेंट ट्रॉमा में इमरजेंसी में है चाहे वो फाइल ना बनाए, लेकिन फाइल कवर के अंदर कुछ पेपर्स जो पेशेंट के वो रख के कैंस नंबर ले लें तो हमारा डेटा एंट्री जो है वो काफ़ी सफिशिएंट हो जाएगी टू शो द गवर्नमेंट दैट वी हैव डन व्हाटएवर इज रिक्वायर्ड, वी हैव डन इट। तो ये जरूरी नहीं है कि फाइल बनाए आप पूरे, जो भी पेशेंट के पेपर होते हैं वो फाइल कवर में रखें और कैश लें और उसको आगे बढ़ा दें ताकि हमारे रिकॉर्ड्स बन जाएंगे। ये बहुत ज़रूरी है। और दूसरा ये कि इंफॉर्मेशन स्प्रेड करने के लिए पब्लिक में और आसपास के जूनियर डॉक्टर्स में और जो पेशेंट यहाँ पर आ रहे हैं दूर दूर से उनके लिए जैसे जगह जगह बैनर लगाने की बात हो रही है, मैं चाहता हूँ कि एक छोटा सा पॉम्फलेट टाइप सिंपल पेपर पर वो भी छपवा दें जिसमें सारी गाइडलाइंस लिखी हो, वो ओपीडी में काउंटर में रखवा दें, वहाँ से वो देते रहे सब पेशेंट को ट्रॉमा में देते हैं, वो देते रहे सब पेशेंट को, तो उससे भी कि अवेयरनेस बढ़ेगी और जो फैसिलिटीज हमारे हैं उनको मालूम चलेगा तो यहाँ आ सकते हैं। बाकी कॉलेज की तरफ से और डिपार्टमेंट की तरफ से जो भी रिक्वायरमेंट होगी सिस्टम में, वी आर हियर टू हेल्प यू एंड आई वंस अगेन कॉन्ग्रेचुलेट ऑल द टीम एंड विश देम बेस्ट ऑफ लक। थैंक यू।
I'd like to request Dr. Shafqat Tasneem to please present a bouquet to Professor Sadia, our eminent guest. And now coming to the crux of the matter, I'd like to request Dr. Muhammad Saqib Alam, our senior resident, who is going to give us a talk about how to diagnose and how to manage a case of hyperthermia.
Thank you, sir. Assalamu alaikum and a very good afternoon, everybody, ladies and gentlemen. Today, I will be talking briefly about how to diagnose and manage a case of hyperthermia and heat stroke. Whenever we talk about hyperthermia is basically due to the excess amount of heat exposure associated with the failure of the body's thermoregulatory mechanism, which leads to imbalance between the dissipation and the production of heat which is there in the body. So when we talk about heat stroke, it's just a part of a whole spectrum of heat-related illnesses which start from like heat edema, heat exhaustion, heat syncope, and heat exertion, heat cramps. So if we talk briefly about all these types, so heat edema is nothing but basically because of when there is excessive heat exposure, the body's mechanism is to have cutaneous vasodilation leading to swelling, and which appears mainly in the lower limbs, ankles and hands of the patient, and it is a very benign and no active any management, just the avoidance of the heat exposure is sufficient for us to cope up with this. If we go further, the other condition can be heat syncope. Heat syncope, when this condition gets more exaggerated, leading to too much cooling of the blood into the peripheries, and that leads to cerebral hypoperfusion that can present as heat syncope because of that. Third is the heat cramps, which are due to involuntary muscle contractions, which are due to a disbalance between the electrolytes between the intercellular extracellular compartment, basically the sodium and potassium, that leads to involuntary spasmodic contractions of the muscles. And going further, then if this is not managed, it can lead to heat exhaustion, which is a minor version of heat stroke. And in this scenario, the temperature level rises above 104 degrees Fahrenheit, and the body's ability to thermoregulate is intact. But these patient present with non-specific symptoms and like headache, dizziness, vertigo, and gastrointestinal problem, influenza-like symptoms. And the management is mainly symptomatic with hydration, and these patients also recover easily. The last thing which comes on the spectrum is the heat stroke, which we are going to talk in detail. Clinically, to diagnose any patient with heat stroke, he should have a temperature more than 40.5 degrees Celsius or 104 degrees Fahrenheit, associated with CNS dysfunction, which can lead from altered mental station to flying seizures, anything, and associated with a history of exposure to a heat or hot and humid environment. So, if we talk about heat stroke is basically there are two types. One is the classical heat stroke, and one is the exertional heat stroke. Classical heat stroke, differentiating the both are important because it will help in the because the management is slightly different, not much. We will talk about that in the management. So classical heat stroke is normally in elderly patients which are having some comorbid conditions, and they are exposed to certain amounts of heat exertion, and so they that leads to precipitation of these their underlying condition that leads to the classical heat stroke. And the other is the exertional heat stroke, which is normally in the older individuals, or in the younger individual, healthy individual, not having any comorbid condition, but they have, as the name suggests, they have prolonged activity in hot and humid environment, have excessive exertion, that leads to the all these the precipitation of the events, and they may present with dangerous complications like rhabdomyolysis, acute tubular necrosis, and chronic renal failure, and it is electrolytemia, and even many a times sudden cardiac arrest. So now, if when I have told briefly about the different times, I would like to come to the management, diagnosis and management. Whenever any patient comes to us in this season, and we should have a high index of suspicion. Any patient with hyperthermia, all hyperthermias is not fever, because this is a common misconception, and because the management is completely different. If it is heat stroke or hyperthermia, NSAIDs or paracetamol or acetaminophen won't help any those patients, and it may lead to even worsening of the condition, because due to heat stroke there is a damage to the internal organs, like there is a hepatic injury because of excessive heat, and if we do paracetamol, that could lead to further exaggeration. So major cause for these patients even dying when they reach the hospital is that they are many a times misdiagnosed as fever, and they are being given paracetamol. So and they are not identified, and the effective measures are not initiated. So everything comes when we start. So first thing is to differentiate how between fever and hyperthermia. So when we start to differentiate, first we will start from the history. In the history, the patient will have a definite history of some exposure to a hot and humid environment. The classical months and the classical time, which like 10 to 4 p.m. or in these months of March to June to July. And he would be working, he would be a laborer, he may be a rickshaw puller, he may be living like in there's a place in Purja, they may be working in their furnaces there in the brick factory. So that would lead to excessive. Apart from this, on clinical examination they would be dry. As compared to fever, where they would be associated with sweating, when there is a change in body temperatures, and there will be no association of any chills and rigors which are present in fever. And the fourth thing is that they will have altered mental status. In fever, that can also be present if the cause is due to any CNS cause, but if they have all the CNS causes of fever have been ruled out, and still they have altered mental status, there is a high chance, high index of suspicion should be taken for heat stroke. So first, when any patient comes to us, first of all we should have properly diagnose it and catch. After the proper diagnosis, we should differentiate if it is a classical heat stroke or an exertional heat stroke. Once we have differentiated this, so we will go further with the treat. We will start with active cooling. After we will, as any case, any emergency, because this is also emergency condition. So any emergency case, first we will look for the airway, breathing, circulation, and access, get an IV access, and send important laboratory investigations. After doing this, we should start with active cooling measures. Active cooling measures include mainly, if it is a case of classical heat stroke, it includes mist and water, misting and air and mist. So mist is we spray cold water, and if not available, tap water can also be used. Ideally, in the guideline it is said that water with 15 degrees Celsius should be used to spray on the patient, and that would be associated with cooling the patient with convection through the air current, that with the help of a fan or a cooler, or so that the amount of heat can be lost from the body with the help of evaporation. So we have to initiate this as soon as we suspect this. After this, if we are suspecting it is due to exertional heat stroke, then we can go for immersion techniques, that the whole patient is like immersed in a water bag or any bathtub, so that all the heat is lost from the body. Apart from this, we can use from ice cubes and ice bags, which are placed in the axilla, groin, and neck and other parts of the body. So and the target of for us in this is to reduce the temperature to less than 102 degree Fahrenheit at the earliest, and normally it is recommended to decrease the temperature of 1 degree Celsius per 10 minutes. This should be our goal whenever such patient present to us. So with these measures, once we have started the active cooling measurement, After that, it's important for us to keep monitor the patient. IV access and IV fluids should be given, but we should keep in mind not to overhydrate the patient. That may lead to iatrogenic pulmonary edema. That patient may be landing up into, because many a times patients who heat stroke, heat-related injury to the myocardium leads to myocardial injury and myocardial damage. That may patient may be in a state of the cardiac output could be decreased, so excess fluid may lead to precipitation of heart failure or other illnesses. So always there should be a balance. Balanced fluid. Fluid is important, but it should be a balance. After we have started the active cooling measures, then we have to measure. We have to check, continuously monitor the patient. Ideally, it should the patient's core body temperature. There should be a continuous core body temperature measurement. But ideally, in this scenario, it's not possible. So we can, in this case, we can take the axillary temperature, and there are different calculators that can give a guess of the core body temperature. If we multiply by 0.9 and add 2.94, so in the axillary temperature, that would be give us an estimate of the core body temperature. Apart from the monitoring the core body temperature, the patient vital parameters should be monitored frequently, and the electrolytes, rapid RPS, the patient's sensorium, the patient's ECG, these things should be monitored, and if any drop in sensorium or any new onset cardiac arrhythmias, so these all with any cardiac arrhythmia will suggest a cardiac involvement or early onset myocardial injury due to heat. And apart from this, electrolytes and vital parameters should be measured, and other mimics should be ruled out, which can mimic like heat stroke, like many withdrawal of many drugs, or drugs like local anesthetics or antihistaminics and antipsychotics. These sometimes may present as like malignant hyperthermia, and these conditions also mimic. So we should rule out all these conditions, and always we have to go with the brain imaging to rule out central causes, because many patients like with pontine hemorrhage can present with hyperpyrexia, and that can mimic as a heat stroke. So in a nutshell is that we continuously have to monitor and check for the parameters, initiate the active cooling, and then we will see for daily monitoring, and all these patients should be ideally shifted to a heat stroke stroke unit which we are having, and any dip in any saturation or any need for ventilatory support, the patient should be shifted to a ICU. So in a brief, this is the main about the diagnosis and the management of any patient heat stroke. So I would give like to Dr. Henderson.
Thank you, Dr. Saqib, for that elaborate talk on the diagnosis and management of hyperthermia. Just on behalf of the hospital administration, I'd like to address the residents, telling them that please understand, most of these patients of heat stroke that will come to you will be destitute. वो ऐसे ही होगा, कोई रिक्शे वाला होगा बेचारा, कहीं रिक्शा चला रहा होगा, और because of heat stroke he will collapse there. So please, you have to take care of destitute patients. This is not excusable that there was nobody with him. देखिए, वो जो आपके साथ अच्छा करे, उसके साथ आपने अच्छा किया तो इसमें कमाल क्या है? उसके साथ करना है जो आपके साथ कुछ नहीं कर सकता. And the real mark of true education is when you take care of those people who can't take care of themselves. So if you think you are educated and you are well read, then please take care of destitute patients the way you would take care of a relative. And the hospital administration is fully behind you. All his drugs, all his tests, all his management is the hospital's responsibility. All you have to do is to bring that patient to our notice. So please take care of all destitute patients when they come, because they might have some other underlying disorder. They might have nephrotic syndrome or chronic kidney disease or CLD, and apart from that they have heat stroke. So it doesn't mean that you would just consider them as fever. So please consider that. Now finally, I'd like to request our chairman, Professor Muhammad Aslam, to give a vote of thanks.
Assalamu alaikum and a very good afternoon to all of you.
A lot has been said about the diagnosis and management and the awareness part. I would just like to tell one thing, that the most dreaded complication is acute tubular necrosis. I have seen a lot of patients in AIDS coming to the nephrology department in the month of June, July, because in Delhi the temperature was around 45, and these patients, just because of a lack of 6 to 10 hours, they all have got anuria. Without urine and on evaluation, we found that the patient is ATN, and that patient landed up in dialysis for at least 4 to 6 weeks. So you see that hydration is very, very important. So we have to educate not our patients but attendants also, which are there in our care in the wards. So this is the most dreaded complication, and once the patient lands into dialysis, no money, and then the problems arise. So basically, the prevention of complications is the main important thing. So all have been said about. I would just like to thank our esteemed principal and dean, sir, Habibullah sir, for coming and gracing the occasion. Amjad sir, for being here, and always both these sirs are supporting us in all our endeavors. They are behind us. Anything we need, they are every time available. I went to them and they said, "You do it, we'll do that." And so thank you sir for coming here. Thank you Salman sir, thank you Sajja ma'am, Dr. Haidar, all the consultants, sister, Dolly sister. She is very supportive, and once you say anything to her, she is always ready to do that. So our nursing staff is also very supportive. Our residents are there. Thank you everyone, our technicians and all those. So in the light note, I will say that everyone has contributed, and I ensure that the whole administration and we are with all of you in the management part. And as Dr. Haidar said, the importance is to take care of the poor and needy. And these patients need special care, and we will provide inshallah special care all to those. And thank you everyone for coming and listening to us. Thank you everyone. Just inviting the guests to have some high tea with us.